The burden is on the rise. The current prevalence rate ranges between 3 and 5%. When you're finding younger patients who are coming with type 2 diabetes, but again, you have even type 1 diabetes. We have a good population, like 60% of our Kenya population, who are unaware that they have diabetes, and that's why the screening need to be done. The good thing in the current state is that there's increased awareness. Currently, the biggest challenge we had the doctor strike, which really affected the kind of care we used to give our diabetic patients. We have really gone behind because the number of patients we used to see, they have come down. We have challenge with the availability of point of care diagnostics testing, and also the availability of some of the essential drugs. Sometimes we miss the insulin, sometimes we have lack of glucose stick, which are essential kits for assessing the level of blood sugar in patients with diabetes. Most of our patients, sometimes they pay out of pocket, and this brings a challenge in the maintaining and making sure the patient is adherent to their hospital visit, and also they are taking their medication. Because a patient with a low level of income may not be able to buy some of the more effective drugs. So when this patient is not able to afford such kind of drugs because of the income, it affects their overall outcome, because they are at a higher risk of going to cardiovascular diseases or renal diseases. People who are well educated, they're more able to grasp some of the information you're able to give them, whereas somebody with a low education, they will have to take more time to really go to their level to be able to explain some of these conditions. We have developed some peer groups. Patients who have diabetes, we invite them in the clinics to talk to other patients with similar issues, so they're able to understand and to reduce the stigma. We had a nurse who had gone out of her way to do some YouTube channels in Kikuyu language. I've given talks in churches. I've also given some talks in some of the in Inoro and the like. We have the DMI Institute, which assists the type 1 diabetes who are less than 18 years. They're able to support giving them glucometers and sometimes free insulin, and again to give them a venue of meeting with other young people with the same type of diabetes. For the young professional, again with this Young and Sweet platform, where now the young people who have the type 1 diabetes, we're able to link them up for further engagement with the peers of this, with the same, sharing the same challenge. Since health was devolved, the county governments have a big role to support the primary healthcare providers with the necessary drugs and the testing kits, which are very necessary in the management of diabetes. So availing these drugs at a value, at a charge or a cost that is manageable. Community health providers, they need to increase their catchment areas to reach out on those people who cannot be able to access the hospital. At a national government, the training, because the policy makers, so the training should be increased so that you can have more people, not just the doctors who are trained to be diabetologists, but you want even the nurses to have more diabetic nurses. We want to have the clinical officers being involved in this. I want to appreciate that this step has already been taken. The Ministry of Health, together with the Novo Nordisk Foundation, they have partnered with Kenya Medical KMTC training colleges, where we are training the lecturers to be able to train the student as they are doing their clinical officers or their nursing training. They're able to be taught on some of these non-communicable disease. We need to give a Kenyan living in Turkana and the one living in Nairobi should be able to have the same, almost the same kind of care, because there's a lot of disparity between the two areas, the very rural areas where they're getting, yes, they're going to get in some form of care, but looks like less than those who are living in high economic states. So you're able to equate that person who is living the farthest, like Wajir and the person living in high cost areas, they're able to access the same kind of insulin, the same kind of a drug that could be it's a welcome thing for the government to do.